But let's talk about some archetypes and talk about the way you assess and then you treat and put interventions in place with someone with really brain fog, maybe a female, a male, someone really struggling with cognitive performance. We do an objective data-centric measurement by Dr. Dale Bredesen called a cognoscopy that has been really beneficial. But I think you've got some real incredible tools and assessment tools of these two different archetypes that come and see you, because I think people are struggling with anxiety and depression and just adrenal burnout and fatigue like never before. So give us just an incredible story of assessment to treatment and intervention with those two archetypes in mind.
Right. When we have anybody over 20, right, and we say like we have to do central nervous system testing and autonomic nervous system, because we have to look at both of these, right? In medicine, there's really no blood test to do that. That's why people go and they say I have chronic fatigue or I have cognitive decline. And then as physicians, we do these iron tests and thyroid tests and we say, screw off, you're good. Like, and then you start on this path. I always have, we see a bunch of pro athletes, so we treat people like they're pro athletes. We have to do these heart rate variabilities, and it's not Oura rings and Whoop bands. Like you actually have to do the testing. And then central nervous system EEGs. When you put those together with hormone studies, and then we look at like, can we produce cellular energy? When you put those three things together, central nervous system studies, autonomic nervous system studies, hormone studies, and you put all those soups together and you see where's the hole in the bucket. And then of course you have to have treatments, because what's the point of seeing it? The person already knows they're tired. When you put these treatments together, which are mainly physics, we do whole brain TMS, exercise with oxygen therapy, hyperbarics, microcurrent. Like when you put those things together and you light up the central nervous system and you feed the autonomic nervous system with electrons and oxygen, magically computers come back online. And, it's still like cognitive decline is irritating to me, because again, in medicine, we don't really do anything with it. I guess in integrative medicine, we'll try to use supplements and bioidentical hormones, right, to address it. But just biologically, we just don't treat it, right? We try to add things and expect that the nervous system's going to respond. But unless we actually treat the nervous system, it's just more noise, right? When we do EEGs now or brainstem, and we look at what somebody comes in with, I guess, brain fog, or we get like a whole bunch of high performing people, and sooner or later, you're going to break it down, right? You're going to use more than you can put back, and then sleep, and just the digital era of so much information coming in, things get tired. And we don't have a way to like pump air back into the tire. And that's where I think, again, bioregulatory medicine, or the treatments that you end up having, that treat specifically the nervous system. I mean, people think it's magic, but it's adding more electricity to something and organizing, getting the noise out, and things just respond.
Okay, so let's go into the details. So let's talk about Jane. That's not her name. She comes in brain fog, tired, exhausted, feeling anxiety and depression. You do a QEEG, exactly what you do from a central nervous system assessment. What can the person expect, and why is it different just to integrative medicine and sort of functional medicine?
Because when you're so you've got a couple different things. People use biofeedback, neurofeedback, or else you're actually going to add electricity with TMS, right? We have all these. So when she comes in and we do that central nervous system testing, and it's maybe the central nervous system is good and the autonomic nervous system is busy, but whatever thing is wrong, you have to use a specific treatment. Most of the time with Jane that comes in, right, we're going to do whole brain TMS, and we're going to add oxygen to it, or do ozone blood therapies. We're going to oxygenate the tissue, and then we're going to add those electricity to the brain. And then the brain is going to respond like it always does. Like if you add electricity to the muscle, it's going to use it, and it's going to start to form new neural pathways, and we're going to see that fog lift. It's for people that don't have head injuries, right? If you just come into fatigue, and maybe it's post-pregnancy, maybe it's like post-illness that we see viral infections now, of course, a lot. Like, again, if you treat the body and you just eliminate the lymphatic irritation, you stimulate the nervous system, it pretty much happens.